Hemorrhoids are a common medical condition that affects many individuals. While the topic of hemorrhoids is well researched and discussed, here are some unique aspects and topics related to hemorrhoids that you may find interesting. Number 1. Nurses and caregivers. Nurses and caregivers, who often assist patients with lifting, transferring, and providing personal care, can face unique challenges when it comes to managing hemorrhoids. Strain from patient handling. Healthcare professionals, including nurses and caregivers, frequently engage in physically demanding tasks that involve lifting, transferring, and repositioning patients. These activities can put significant strain on the body, including the rectal area, potentially exacerbating hemorrhoids. Here are some key considerations related to patient handling and hemorrhoids for nurses and caregivers. Lifting patients who may be larger or heavier than oneself can strain the back, pelvic floor, and rectal area. The exertion required during these activities can increase abdominal pressure, potentially contributing to the development or aggravation of hemorrhoids. Nurses and caregivers often spend long hours on their feet, attending to patients and performing various tasks. Prolonged standing can lead to increased pressure on the rectal veins and hinder optimal blood circulation, potentially contributing to the development of hemorrhoids. Repositioning or transferring patients, particularly those who are immobile or have limited mobility, may involve straining and significant physical effort. These actions can increase pressure on the rectal area, potentially worsening existing hemorrhoids or causing new ones to form. To help manage hemorrhoids while working as a nurse or caregiver, consider the following tips. Practice proper lifting techniques and body mechanics to minimize strain on the rectal area. Utilize equipment and assistive devices, such as patient lifts or transfer belts, to help reduce the physical demands of lifting and transferring patients. Whenever possible, take short breaks to rest and relieve pressure on the rectal area. If standing for long periods is required, try shifting weight from one leg to the other or using supportive footwear to minimize discomfort and promote better blood circulation. Engage in regular pelvic floor exercises, also known as Kegel exercises, to strengthen the muscles that support the rectal area. Stronger pelvic floor muscles can help improve blood circulation, reduce strain, and potentially alleviate hemorrhoid symptoms. Pay attention to body mechanics and ergonomics when performing patient transfers. Seek assistance from colleagues or use equipment to ensure safe and efficient transfers, reducing the strain on your body and rectal area. Nurses and caregivers often prioritize the care of others, but it's important to remember to prioritize self-care as well. Stay hydrated, maintain a healthy diet, and manage stress effectively. These factors can contribute to overall bowel health and potentially reduce the risk of hemorrhoid development or aggravation. They may be able to provide support, suggest modifications to work procedures, or explore ways to alleviate some of the physical demands associated with patient care. Number 2. Factory workers. Factory workers, particularly those involved in jobs that require heavy lifting, repetitive movements, or long hours of standing, can face challenges that contribute to the development or aggravation of hemorrhoids. Here are some key considerations related to factory work and hemorrhoids. Repetitive movements. Engaging in repetitive motions, such as bending, twisting, or reaching, without sufficient breaks or proper body mechanics, can strain the rectal area. The continuous pressure and repetitive stress on the rectal veins can contribute to hemorrhoid symptoms. Prolonged standing. Factory workers often spend long hours standing on hard surfaces while operating machinery or performing tasks. Prolonged standing can impede blood circulation, leading to blood pooling in the rectal area and potentially increasing the risk of hemorrhoid development. To help manage hemorrhoids while working as a factory worker, consider the following tips. Use proper lifting techniques. Practice proper lifting techniques to minimize strain on the rectal area. Bend at the knees and use your leg muscles rather than relying solely on your back when lifting heavy objects. Utilize assistive devices or equipment, such as forklifts or hand trucks, whenever possible to reduce the physical demands on your body. Wear supportive footwear. Choose footwear that provides proper support and cushioning to reduce the strain on your lower back and lower extremities. Supportive footwear can help improve overall posture and minimize discomfort in the rectal area. Practice healthy lifestyle habits. Maintain a healthy lifestyle by staying hydrated, consuming a balanced diet, and engaging in regular physical activity. These factors contribute to overall bowel health and can help prevent constipation, a common risk factor for hemorrhoids. Communicate with supervisors. If you encounter challenges related to heavy lifting, repetitive movements, or prolonged standing, discuss your concerns with supervisors or safety representatives. They may be able to suggest modifications to work procedures or provide additional support to minimize the strain on your body and rectal area. Number 3. Athletes and weightlifters. Athletes and weightlifters often engage in intense physical activities that can impact the development or exacerbation of hemorrhoids. Here is the association between weightlifting and hemorrhoids. Intense physical exertion. Athletes and weightlifters subject their bodies to high levels of physical exertion during training and competitions. This intense activity can increase abdominal pressure, which, in turn, puts strain on the rectal area and may contribute to the development or worsening of hemorrhoids. Here are some key considerations related to athletes, weightlifters, and hemorrhoids. The straining and bearing down associated with heavy weightlifting can cause increased abdominal pressure. This pressure can negatively impact the rectal veins and contribute to the development or exacerbation of hemorrhoids. Endurance sports. Participating in endurance sports, such as long-distance running, cycling, or triathlons, can lead to prolonged periods of physical exertion. Sustained exertion, combined with increased abdominal pressure, can be a contributing factor in the formation or aggravation of hemorrhoids. Impact sports. Certain impact sports, such as football, rugby, or martial arts, involve forceful movements and physical contact. These activities can lead to increased pressure on the rectal area and potentially contribute to the development of hemorrhoids. To help manage hemorrhoids while participating in sports or weightlifting, consider the following tips. Practice proper breathing techniques. Pay attention to your breathing during physical activity. Avoid breath holding or bearing down excessively, as this can increase abdominal pressure and strain the rectal area. Focus on maintaining a controlled and steady breath throughout your exercises. Include rest and recovery. Adequate rest and recovery are crucial for athletes and weightlifters. Giving your body time to recover between training sessions allows the rectal area to recuperate and reduces the risk of developing or aggravating hemorrhoids. Manage training volume and intensity. Be mindful of your training volume and intensity to avoid overexertion. Listen to your body, and if you experience discomfort or signs of hemorrhoid-related symptoms, consider adjusting your training routine or seeking guidance from a sports medicine professional. Utilize supportive gear. Depending on the sport or activity, consider using supportive gear, such as compression garments or belts, to help promote proper blood circulation and reduce strain on the rectal area. If you've enjoyed this video and helped you learn more about hemorrhoid, please be sure to subscribe to our channel and click the notification bell so that each week we release a brand new, life-saving video, you'll get notified right away.